Dengue fever is caused by the dengue virus, which is transmitted to humans primarily through the bite of infected Aedes aegypti mosquitoes. Once the virus enters the bloodstream, it infects white blood cells and begins to replicate, spreading to various tissues, including the liver, spleen, and lymph nodes. The body's immune system responds by producing antibodies which can help control the infection, but in some cases may contribute to severe immune reactions during subsequent infections with a different dengue virus serotype. The infection initially causes flu-like symptoms such as fever, headache, muscle and joint pain, and rash. In severe cases, it can progress to dengue hemorrhagic fever (DHF), characterized by plasma leakage, bleeding and low platelet count, or dengue shock syndrome (DSS), which can lead to dangerously low blood pressure and organ failure. The virus triggers inflammation and vascular permeability, which are central to the pathophysiology of severe dengue. Early diagnosis is essential and is typically confirmed through blood tests detecting viral antigens, RNA, or antibodies. Treatment is mainly supportive, including hydration, fever management, and careful monitoring of platelet levels and organ function. There is no specific antiviral cure, so prevention through mosquito control, personal protection, and community awareness is crucial. Prompt medical attention during the critical phase of the infection can significantly reduce the risk of complications and mortality, especially in children, the elderly, and individuals with underlying health conditions. Symptoms: 1. Sudden high fever. 2. Severe headache. 3. Pain behind the eyes, retroorbital pain. 4. Joint and muscle pain, breakbone fever. 5. Fatigue and weakness. 6. Nausea and vomiting. 7. Skin rash appearing 2-5 days after fever. 8. Mild bleeding, nose or gums. 9. Abdominal pain. 10. Severe cases may include internal bleeding, low blood pressure, or shock causes. Dengue is caused by the dengue virus, which has 4 distinct serotypes: DEN1, DEN2, DEN3, DEN4. It is transmitted to humans through the bite of an infected Aedes mosquito, which becomes infected after biting a person with dengue virus in their blood. Diagnosis: clinical assessment of symptoms and recent exposure. Item: blood tests. Complete blood count (CBC) detecting low platelets and dengue NS1 antigen or IgM-IgG antibodies. In severe cases, monitoring liver function and coagulation profile. That 8. Treatment: there is no specific antiviral treatment for dengue 1. Supportive care includes there is an AD/AD/OS O hydration, oral fluids or IV fluids for severe cases. O fever and pain relief using paracetamol. Avoid NSAIDs like ibuprofen or aspirin due to bleeding. Risk: O bed, rest and monitoring for warning signs. Hospitalization may be required in severe cases with bleeding, organ involvement, or shock. Diet plan: hydrating foods, water, coconut water, clear soups, herbal teas, light, nutritious meals, fruits, vegetables, rice, porridge. Include foods rich in vitamins C and K to support immunity and blood healthy. Avoid spicy, oily, and heavy foods that strain digestion. Frequent small meals to maintain energy during recovery. Prevention: avoid slacked mosquito bites. Use repellents, long-sleeved clothes, and mosquito nets. Eliminate mosquito breeding sites, stagnant water around home sites. Community-level vector control programs. No widely available vaccine for general population in most countries. Vaccination is limited to some regions that would be vaccination under strict guidelines. Conclusion: dengue fever is a serious mosquito-borne viral infection that can range from mild to life-threatening. Early recognition, proper hydration, supportive care, and prevention of mosquito bites are key to managing and preventing dengue outbreaks. Subscribe to my channel for more health related videos and tips.